Initiative for Health Accountability and Transparency welcome you to continue professional development course on primary healthcare renewal for optimal performance, Module 5 on policy and strategic options for improving PHC performance. The outline of this module includes the learning objectives, current realities in PHC in Nigeria, various elements that constitute policy and strategic options for effective PHC system, and the conclusion. On completion of this module, participants will be able to understand the current realities in PHC in Nigeria. They also understand various policy and strategic options for effective PHC system. There has been some progress in PHC development in Nigeria, but a lot of more work needs to be done. There have been landmark periods of PHC development like we have highlighted in the past modules. The PHC Renaissance or rebirth was accomplished between 1986 and 1992, and also the National Health Policy 1988 was articulated with primary healthcare as the cornerstone. A number of provisions in the National Health Policy 1988, as we highlighted earlier, affirm the centrality of PHC to the achievement of an effective and efficient health system for all Nigerians. But in Nigeria, better health is not everywhere. However, it will be untruth to say that Nigeria has not had growth in health development. Let us have a brainstorming exercise. What is the current realities in PHC in Nigeria? There is stagnation and underperformance in many spheres of primary healthcare development. The country's health status indicators are still very suboptimal, and this is a reflection of the capacity of primary healthcare, because like we always say, primary healthcare is the main determinant and the driver of health outcomes. According to WHO, the African Regional Health Report 2014, which we had earlier highlighted in the previous modules, Nigeria's maternal mortality is only better than that of Chad, Niger, South Sudan, Liberia, Guinea, Congo DRC, Central African Republic, and Sierra Leone. Health is wealth, and using health as the basis of measurement means we are indeed a poor country. Despite considerable investments in the health sector over the years, availability of functional health facilities still presents significant obstacle. We are familiar with the core values of primary healthcare and the essential healthcare concept. Essential healthcare cannot be said to be truly universally available in Nigeria. The truth, practically our efforts are not paying off enough and we are not getting the desired result. The poorest Nigerians are deprived of access to basic health services. Undeniably, there are difficulties and challenges. The difficulties and challenges range from political, strategic, technical, operational, and community issues, and can be discussed under broad categories such as inadequate political commitment, poor governance, lack of funding security for health services and public health, and dysfunctional and deteriorating infrastructure, which has been highlighted in Module 3. Undoubtedly, primary healthcare in Nigeria needs a revolution to restore faith in primary healthcare services. It is time to unleash new policy and strategic options. What policy and strategic options do we have? You can do a brainstorming exercise on this issue and note in few words what you think are policy and strategic choices for turning around the fortunes of primary healthcare in Nigeria. Let us look at the key actions that are necessary to put primary healthcare back. First, we need to put health on the national political agenda. There are options of reposition of the ministries of health to promote functional integration. There is the option of full operationalization of the National Health Act and the revised National Health Policy. We will need to institute innovative financing mechanisms, strengthen the LGA Health Authority, undertake primary healthcare human resources reform and capacity development, strengthening leadership management and governance, and increase the focus on results. We need to advance a community and client-focused health system, promote citizens' engagement and accountability, implement innovative public-private partnership, and also improve health data availability for evidence-based decision-making. Let us look at the first option of putting health on the national political agenda. Health is wealth and must be so treated in the national discourse. A national health agenda whose underpinning principle will be universal health coverage is necessary for us to deliver in a truly Nigerian way with the voice and accountability to the citizenry. We need to promote health as a fundamental right of all Nigerians and promote health in all policies of government and also promote health in all manifestos of political parties. Looking at the option of repositioning of ministries of health and improving functional integration, the role of federal and state ministry of health should be re-examined for its repositioning as chief health policy maker and regulator of quality of care, among other relevant strategic functions. Lack of functional integration between other levels of care and inadequate management capacity has compounded dysfunctionality at the local government healthcare level. Repositioning should aim at moving towards functional integration of primary and secondary care levels. It should also include organizational and functional reform towards harmonization of parallel governance structures existing for primary and secondary care. This is a great hindrance and constitutes a grave challenge for functional integration. Harmonization should lead to the establishment of Nigerian Health Service similar to the Ghana Health Service. Under the current arrangement, the National Primary Healthcare Development Agency has statutory responsibility for providing support to states and local government for the development of primary health care. While there is no federal platform for providing such support to secondary care, Nigerian Health Service can evolve from NPHCD with expanded mandate to provide support for the development of both primary and secondary health care through state health service. The states may need to establish the state health service with concurrent functions for management of both primary and secondary care. This will bring primary and secondary healthcare under one roof as unified state health service and promote functional integration. The state should have a unified health service with the secondary facilities being the hub of the state health service and the primary healthcare being the spoke. The current situation where secondary care is managed by state hospital boards while primary healthcare is managed by state PHC agencies and boards will not promote functional integration. looking at the issue of full operationalization of the National Health Act and the revised health policy. Operationalization of National Health Policy and the Act in a manner that guarantees universal access to basic health services for all Nigerians through a functional primary health care is very, very fundamental. The policy and act should be backed with requisite investments at the relevant levels to overhaul the service delivery infrastructure, human resource quality, regulatory instruments, drugs and supply, and commodity distribution systems to deliver quality services, focusing on the most vulnerable populations first. Full operationalization should include additional resources for health, which can be mobilized through special taxation. We need to institute innovative financing mechanisms. Financial barriers to access to health service are very significant. Improving geographical and financial access can be achieved through effective implementation of Basic Healthcare Provision Fund. Basic Health Provision Fund should be operated as a funding mechanism and direct support to the primary healthcare at the LGA level. It should not be an implementing agency. It will be recalled that the WHO review team had recommended some form of special budget support to the LGA PHC in 1992. Basic Healthcare Provision Fund should now represent this special support. However, to ensure financial integrity in the fund, transparent public expenditure management system should be instituted and social accountability approaches instituted. Instituting innovative financing mechanisms should also include rapid expansion of community-based health insurance scheme and effective implementation of performance-based incentive system for primary healthcare service delivery to improve effectiveness and quality of care. Strengthening the LGA Health Authority. The LGA Health Authority holds the key to functional and effective primary healthcare in Nigeria. The LGA level represents the third tier of the PHC development framework. It should be noted that PHC is a frontline function and cannot be decreed from Abuja or even the State Ministry of Health. Only the LGAs, by their proximity to the grassroots, are strategically placed to deliver on primary healthcare. We need to note that the LGAs have no capacity to deliver effective primary healthcare services and thus require strong support and oversight by the state governments. LGA is the operational level, and the structures and institutions at the LGA level provide overlapping operational support. It is at this level that all resources, both human and material, are pooled for implementation of primary health care. Let us look at the obstacles at the LGA level. Weaknesses in the LGA Health Authority have been the most daunting and most intractable challenge in developing a sustainable, functional PHC system. For meaningful and sustainable progress in PHC development, this level must be sufficiently empowered in all ramifications. Addressing the obstacles will include appropriate human resources and capacity, both in quality and quantity in technical and management areas, including financial management. Financial authority for operations funding is very important. The budget of the LGA Health Authority must be sufficiently funded, and the department or authority be sub-accounting with the head designated as officer controlling expenditure with financial responsibility. This will promote smooth and unimpeded program implementation. Other things to do should include effective management support system by the state, and this should include routine supervision, monitoring and evaluation. Good management support system that enables supportive supervision, program monitoring, mentoring, evaluation, and sufficient operational logistics must be established. It is mandatory for federal government to mobilize sufficient political commitments towards strengthening the LGA Health Authority. There can be no progress in PHC implementation without addressing the aforementioned requirement at the LGA Health Authority. In order to effectively address the challenges at the LGA Health Authority we have mentioned, we need to note this caveat. The PHC reform, also known as PHC under one roof, was informed by the need to streamline and harmonize the role of stakeholders in PHC development with the aim of strengthening PHC at the operational level. Therefore, the state PHC agencies or boards, as the case may be, must not operate as the State Ministry of Health. If they do, the envisaged gains for creating the state PHC agencies will not be realized. They should exercise more of coordination and facilitatory function aimed at empowering and building stronger LGA health system. Their existence and roles will be meaningless without strong LGA health authorities. As part of policy options and strategies is the need to undertake PHC human resource reform and capacity development. By default, PHC facilities are traditionally manned by low-level professionals in Nigeria. The community health extension workers are trained for community health extension work. They are at PHC facilities doing everything but community health extension work. As a matter of priority and necessity, it is time to reorientate them and empower them towards their community work. Furthermore, we need to move our way into an era when our communities deserve more professional care at the frontline facilities. To move towards professionalization by deployment of nurses and midwives to the PHC level. The excuses will be the issue of availability of medical officers, nurses, and midwives, but we all know that there are a number of them that are not employed. They are in the labor market. Also, as a matter of policy, it is time to adopt deployment of family physicians to the LGS to lead the PHC team. Migration of medical and allied professionals between different levels of care, that is often between LGA to state level and to federal, is due to poor motivation and differentials in condition of service, and this will need to be addressed. We also need to advance a community and client-focused health system. The Nigerian health system is focused more on the health providers than the people. That is, the focus is more on the supply side than on the demand side. The discussion is usually about availability of health facilities, equipment, drugs, and healthcare workers with little attention to responsiveness of the system. Things must change as part of policy options that are required for revival and renewal of primary healthcare. Formal recognition of WDCs as co-owners and implementers of PHC should be a top priority. Ward development committees will need to be activated or reactivated in all the political wards based on set guidelines, and they serve as entry point to mobilize community for health action. There is also need to promote citizen engagement and accountability. Lack of accountability has been cited as one of the underlying causes of poor performance in the health system. In the absence of accountability, merely allocating public resources for health goods and services may not necessarily lead to desirable health outcomes. And this is one of the major challenges in the health system in Nigeria. For a PHC service delivery process to be accountable to the citizens and the public, it must be community-led and community-driven. To foster this, we need to adopt social accountability approaches. Social accountability refers to the broad range of actions and mechanisms used by citizens to hold accountability actors to account. And these actors include service providers, the government. The community-based platforms like the World Development Committees, civil society, media, and other society actors should promote or facilitate social accountability efforts. Social accountability mechanisms are effective for mobilizing citizens to demand for more responsive service providers, reduce corrupt tendencies, and also improve the quality and availability of health care. Faith accountability fuels abuses, non-compliance with ethics, standards and procedures, frauds, waste, and undermine healthcare delivery and result in poor performance. World Development Committees should amalgamate to find stronger voice. Citizens' voice is key to better health. Citizens' voice is key to better health. We need to strengthen leadership, management, and governance capacity and increase the focus on results. Leading, managing, and governing a modern health system is a challenging mission that requires trainings beyond technical knowledge. Health leaders and managers require special skills to facilitate efficient use of resources and better management practices, teamwork, ability to motivate people, communication skills, process-oriented thinking, and the capacity to cooperate in local networks that is required in primary healthcare service delivery. Inadequate capacity in leadership, management, and governance in all levels of the health system severely limits scaling up of services and achieving better health outcomes. Therefore, strengthening leadership, management, and governance capacity and practices during pre-service training and in-service in a rational, systematic, and sustainable manner is fundamental to better health outcomes. We need to look at other strategies like implementation of innovative public-private partnership for delivery of primary healthcare services to make use of abundant opportunities in the private sector and also improve health data availability for evidence-based decision making. Let us take an online assignment. In what ways does the current situation at the LGA level constitute serious impediment to primary healthcare implementation? You are requested to do online submission to be marked CPD PHC assignment of not more than 500 words on the above issue to iheartnigeria@gmail.com. Let's not forget the vision of the future of Professor Olikoye Ransom Kuti, the former and late Honorable Minister of Health. And he says that, as Minister of Health, my vision of the future is quite clear. I look forward to the day when, for all time, the fear of ill health will be removed from our homes and villages by the availability of health services that are accessible, affordable, and acceptable to every Nigerian. I believe that comprehensive PHC is the most powerful strategy to achieve this happy state for our people. I also believe that we have made some real progress in putting primary healthcare system in place in Nigeria. Several years after this vision, we are now struggling to achieve universal health coverage. If we do, we will have helped lead Professor Kuti to achieve his vision of the future for Nigerian health system. Drawing conclusion from the module, strong PHC is essential for improving health outcomes and accelerating progress towards universal health coverage. Despite considerable investment in the health sector over the years, availability of functional health facilities still presents significant obstacles. There is stagnation and underperformance in many spheres of primary healthcare development in Nigeria. In order to achieve national and international health goals, including universal health coverage, greater effort should be targeted at sustainable investments and implementing reforms in key policy and strategic areas like we have discussed in the course of this presentation, and it includes putting health on the political agenda, repositioning of the ministries of health, organizational and functional reforms, full operationalization of National Health Act and the revised health policy, strengthening the LGA conundrum, PHC human resources reform and capacity development, expansion of community health insurance scheme, and promoting social accountability. Call to service. Primary healthcare performed well in the late 1980s, precisely from 1986 throughout the early 90s, precisely up to 1992, and can perform well again. Putting primary healthcare back on the national agenda is a task that must be done. Our dream for a strong health system and better health outcomes will remain a dream unless we work for it. Our belief is that implementing key policy and strategic options is a necessity for improving primary healthcare performance in Nigeria. And this will require strong leadership, effective management, and transparent governance in the health system is the key.